Can hypothyroidism go away on its own? Mild hypothyroidism may not require treatment. I was recently diagnosed with mild hypothyroidism, which does not cause any symptoms. My doctor said I don't need treatment now, but she wants me to come back regularly physical examination. Does hypothyroidism usually get worse over time? If so, what should I do? Remember to subscribe, comment, share and like it. Click on the bell to be informed of the latest videos uploaded. Thanks. For mild cases of hypothyroidism, not all patients need treatment. Sometimes, if left untreated, the condition may be relieved. Follow-up date pair monitor hypothyroidism over time. If hypothyroidism does not go away on its own within a few months, it must be treated. If left untreated, this may eventually lead to serious health problems. The thyroid is a small butterfly-shaped gland at the front of the neck that makes triiodothyroxine (T3) and thyroxine (T4) hormones. Those hormones affect your metabolism. They can maintain the body's consumption of fat and carbohydrates, help control body temperature, and affect the heart rate and help regulate protein production. The amount of thyroid hormone produced by the body is regulated by another hormone called thyroid-stimulating hormone, or TSH, is produced by the pituitary gland. When the thyroid gland cannot produce enough hormones, hypothyroidism occurs. As a result, your metabolism slows down. As thyroid activity slows down, the level of T4 in the body decreases. TSH level rises to encourage the thyroid to increase T4 production. Some cases of mild hypothyroidism, called subclinical hypothyroidism, are associated with elevated TSH while T4 levels remain within the normal range. At that point the condition may not produce any obvious symptoms. However, if the decline in T3 and T4 continues, called overt hypothyroidism, it will affect many people's body function. Common early symptoms of hypothyroidism include unexplained weight gain, fatigue, and low energy. It may also cause dry skin, constipation, sensitivity to cold, and puffiness, facial, muscle weakness, hoarseness, and joint pain or stiffness. Remember to subscribe, comment, share and like it. Click on the bell to be informed of the latest videos uploaded. Thanks. Hypothyroidism can slow down the heart rhythm, which affects the heart. It also affects the body's ability to effectively metabolize cholesterol. This can lead to elevated blood cholesterol, increases the risk of heart disease and cardiovascular events, such as heart attack and stroke. Hypothyroidism can affect the brain and cause attention and memory impairment. It also affects the gastrointestinal system and reduces bowel movements, exercise and constipation. In premenopausal women, hypothyroidism affects the menstrual cycle and fertility. Hypothyroidism is diagnosed through a blood test, which measures the level of thyroid hormone in the body. Regular blood tests for monitoring thyroid hormone levels. If hypothyroidism persists for more than a few months, treatment is usually recommended. The standard treatment for hypothyroidism is to take a daily oral medication called levothyroxine, which is a synthetic form of thyroid hormone. It restores the body's hormones. Reducing it to a normal level can reverse the signs and symptoms of hypothyroidism. The amount of levothyroxine required varies from person to person. To determine the right dosage for you, your healthcare provider will check your thyroid hormones. Perform the first blood test 6 to 8 weeks after starting the medication. After that, blood levels are usually checked every 6 months. Then, if the level stays within the normal range for a few years, you can usually switch the monitoring to once a year. Some drugs, including over-the-counter drugs, can affect the absorption or metabolism of thyroid hormone tablets, so whenever you start taking it or stop using other drugs. It is important to take this medication correctly, because too little levothyroxine cannot adequately control hypothyroidism, and too much can cause side effects. Loss of appetite, tremors, irregular heart or heart rhythm, etc. Remember to subscribe, comment, share and like it. Click on the bell to be informed of the latest videos uploaded. Thanks. Work with your healthcare provider to establish a schedule for your follow-up visits. With careful monitoring and treatment, hypothyroidism can be effectively controlled, eliminate symptoms and reduce your risk of complications due to this situation. Check out the description of the video below to get more information. HNON, link, hypothyroidism.